Stefan's here from Archipelago Healthcare, and leading nicely on from Keaton's first presentation, this is about some of the applications of some of these ideas in actual healthcare systems. And I think particularly, and some with psychologists even.
Mm-hmm. Yes.
Psychologists as content.
Yep.
So I'll let Stefan get on with it.
Okay. Thank you very much. Well, I was just saying to David that I'm one of those people that Keaton mentioned in his presentation that tries to join large organisations and never really fitted in anywhere. So, so I'm going to try and live up to that reputation and be a bit more controversial in the next hour or so. I know you've got a debate coming this afternoon, and I suspect that the more I can stoke things up, the more useful it will be for you. Just as a word or two about me, I mean, I very much like Keaton. I'm a management consultant. Perhaps not so much like Keaton. I've worked almost exclusively in the last 3 to 5 years in mental health services, and I have had some experience of working in psychological services. And I think if you were detecting that there is a divide between the theory and the practice of lean, I think you'd be correct. I'm sure Keaton would admit that straight away. A lot of these things are hard to bring about. And I think it's fair to say that I've encountered most situations where I'm trying to apply some of the things you've heard in the first session and found it sometimes difficult and had to think about adapting ways of doing that. I also want to say thanks very much for having me, because my honorarium today is going to the very worthy charity Help for Heroes. I was in the army before I started this sort of profession, and so my fee is going to them. So thank you for that.
Was that another large organisation you didn't fit?
Sort of, yeah. Well, you're the psychologist. You work it out. Okay.